Good afternoon. On behalf of EFNA, I'm happy to welcome you to this panel discussion on patient and public participation and on cutting evidence into practice, which, as you know, aligns with the central theme of the EAN meeting that we are at today. My name is Joke Jaarsma. I'm president of EFNA, and for those of you who are not familiar with EFNA, we are the European Federation of Neurological Associations, and we represent the disease-specific patient groups in Europe on about 20 diseases at this stage. And in that capacity, we strive to be the voice of patients in Europe. Today, we are going to talk to some of the prominent EAN members on the areas of their expertise. And I'm very happy to be able to kick that off by talking today with Professor Richard Dodel from Essen in Germany. And I'm now handing over to Professor Dodel and asking him to introduce himself. Professor Dodel.
Good morning. Good morning, ladies and gentlemen. My name is Richard Dodel. I'm a neurologist and geriatrician at the University Duisburg-Essen, and my scientific work mainly focuses on neurodegenerative diseases. However, we are also interested in health economic evaluations of neurological diseases. Together with the ENA and the Lindbergh International Neuroscience Foundation, we started a project to assess the burden and the costs of neurological diseases in Europe. We selected 47 EAN countries, and we will evaluate 18 neurological disorders and bring together epidemiological data such as prevalence, incidence. We will also calculate dailies, QALYs, quality-adjusted life years, for those disorders, and finally also the costs. The last major effort in this area has been done in 2010 by the European Brain Council, and Gustafsson published a couple of papers on the costs of neurological disorders in 2010 to 2012. Yesterday, I presented some of our new data on sleep disorders and their consequences. Sleep disorders by itself are not very costly compared, for example, to Alzheimer's disease or Parkinson's disease or multiple sclerosis. But due to the large amount of affected people, costs of sleep disorders are high. For example, the Sleep Foundation of Australia calculated costs of 51 billion Australian dollars for sleep disorders, which makes around 35 billion European euros. And so it's the fourth most expensive disorder in neurological disorders. However, if you look at the funding, it's considerably different from that. For example, if you look at cancer, there's high amount of funding. Approximately in the US, 94% of funding goes into this area. However, if you look at the epidemiology or the dailies which are generated by sleep disorders, less than 0.2% of research funding goes into sleep disorders. Or if we look at this session or this convention these days, just look at the number of sessions on multiple sclerosis or Parkinson's disease or dementia and look on the numbers of sleep disorders. You will find a huge difference on the impact of sleep disorders compared to multiple sclerosis or Parkinson's disease. Sleep disorders are 25 times more common than multiple sclerosis, for example. The goal of our project has three dimensions. The first dimension is we want to produce and provide evidence-based and transparent data on the burden of neurological disorders for especially decision makers, politicians, but also for healthcare professionals. The second point is that we want to sensitize for the high burden of neurological disorders compared to other disorders like cancer or heart diseases. And for the third point, which is the most important, that we can help to bring more funding and more interest into neurological disorders which are important for our patients we care for. That's my short presentation.
That's wonderful. Thank you. That's wonderful. Thank you so much. Of course, the questions are now coming. If you compare sleep with, for example, as you said, MS, and then we look at the funding, that's going to be a really important issue to be discussed in view of the ever-increasing socioeconomic and healthcare costs that we are all facing in the world, and especially also in Europe at this day and age. So how do you see that your studies, when they get the proper attention from policymakers, from researchers, are going to impact the public, the patients?
We will see. I mean, this is always a difficult question. What is the impact? For example, if you look at the data from Gustafsson on the 2010 papers, I mean, it took 2-3 years until it had an impact. For example, Gustafsson and I was part of this group, we went to the Brussels Parliament and presented the data there, and there was a huge interest from members of Parliament who came there and discussed with us the costs of neurological disorders. So I don't see that this, when we finish the project, it will be finished this year in November or December, and we will publish then the data. I don't think that in January already we will have a benefit of that. No. But I think we have data then available on which we can start to influence politicians, policymakers, and tell them neurological disorders are important and we need help to help our patients.
Absolutely. But one question I have, in the study that you just described, did you have patients participate in that study?
Mm-hmm. No, in this is just systematic research work. Yes, so we have no studies, no patients involved. There's a large study which has started here not here in Austria, in Switzerland, from Claudio Bassetti and Dr. Kalweit, who want to evaluate the costs of sleep disorders in different European countries. And they have involved patient groups, and they have involved also patients, and they will investigate these patients. So I hopefully that many people, and especially patients, will donate their time to bring this study to a success.
As a matter of fact, EFNA are involved in that study, as you might expect.
That's correct.
But how do you then see the importance of involving patients in studies like this? What does it add to your research, in your view? Mm-hmm.
I think it's very important that we involve patients, and especially the patients' organizations, because first we need help to recruit patients for these studies, and this is easier if you have help from the patients groups. The second point is that we start, normally we have done a couple of health economic studies. It's very important to discuss this with patient organizations, because they bring us a different view, yes, which we sometimes don't see as much as we are clinicians, because people, for example, come to our clinic, you see them half an hour, 3/4 of an hour, but all the other aspects are totally different. For example, we had a study on late-stage Parkinson's disease. It was funded by the EU, and we had to go to the patients because they were not able to come to the clinics. So the first time for my life, I visited patients at home, yes, and it was so frustrating for me, because these patients were often not treated adequately, because the neurologists do not come to the home, at least in Germany. It's almost the general practitioners. They do a great job, but I mean, for some things you need a neurologist. For treatment, for example, I saw a patient with 450 milligrams quetiapine, yes, and he was totally sleepy all the day because he had hallucinations. So we started to change the treatment, and he got much better. I mean, he didn't stand up from bed and walk around, but at least he could participate in the life of the family. So I think we need especially for those studies, to understand what are the problems of patients who are not able to come to the clinics.
It's one of the big barriers.
Yes, that's a major barrier. And for me, this was the first study. I must confess that I learned so much from this study on Parkinson's disease.
Well, we have actually done a very small survey within the EFNA community about sleep and which diseases do actually have insomnia or other sleep problems. And I was really surprised to see that, like the dystonia patient, they have enormous sleep problems. I never realized that. So it's a very broad and very wide topic that we are now addressing. So, and I'm sure if we made a call for patients, we would be able to be of assistance here. I think Orla over there has a question.
Yes, I think this microphone is working. Professor Doddle, I wanted to ask you a question with 2 and possibly 3 parts to the answer. When it comes to economic analysis for any condition, but in this example using sleep-wake disorders, how difficult is it, or is it difficult, to isolate data that is relating to economic impacts for those patients who are children and adolescents versus adults, and then how accurate, or is there a need for greater precision to investigate the economic impact on the caregiver? So again, if we take that pediatric component and address the issues that a parent may have if they have a child with a sleep-wake disorder or a condition that has that symptomatic profile.
In our study, we did not involve children, so I can't give any information about this issue. This is a pity, I must confess, but to evaluate costs and the burden for children, you need a totally different approach. And the second one is there are not much data on children and, for example, sleep disorders or any neurological disorders. There are pretty much nothing, in the literature. So we decided together with the EAN that we first focus on the adult patients and then have a look especially on children.
And the second part, and I hope you don't mind me asking this, is just the pursuit of the impact on caregivers and the family members, whether that's a spouse or maybe, for an older adult, it could be a child looking after an older adult. When it comes to the economic impact there, is it considered often in these types of studies, or is that a trend that we're seeing an increasing rate of addressing the impact to care providers?
I mean, I would say starting about 8 years ago, most of the economists also included informal costs in more detail, because before we just looked at formal care. For example, in Alzheimer's disease, how much nurse time do we need, how much hospital time do we need, and so on. But since about 8 years, I would suggest that informal care has become a very important part, because we realized that the number, let's say just the number of hours family members include in the treatment and care of their family or their relatives, it's huge. And from the cost perspective, it's much more than the formal care. The problem only is, how do you value informal care? Do you say the hours you spend with your family member who is ill is similar if this person would work as, let's say, as a physician or as a whatever he learned from, or do we just say it costs 9 euros a day or the lowest wages you can have? This is still a major discussion, a major point, because this makes huge differences, and therefore informal care, depending on the method you use, you can have a difference of 40 to 50%.
It's a really interesting topic, and it's one that the neurologist...
It's not very complicated. It's just you have to decide how much money you put on an hour for the caregiver, for his help. That's the major topic, and currently we do not have a consistent method on this topic.
Thank you. To date, I think
We have one more question, please.
Should I go there, or can I ask here?
No, behind you, sorry.
Yes,
So you're on the big stage.
Yes, exactly. I've been promoted, so I think it's a really excellent job, and it's great that it's being updated. And I was kind of participating in the Parliament event when we were launching with the European Brain Council. The first study we had Danuta Hübner, who was hosting it, and she was then a EU commissioner, so very high. She's a professor in economics, and as you say, it attracted a lot of attention, and I think the cost study really moved the needle back then. And you can also, I think, within the study, you had also a mention of, because this was brain disorder, so it included mental health. But from what I remember, it was mentioned inside that the cost of neurological diseases was 370 billion, something like this. So now we'll have an update, and I think this is really important because, of course, a lot changed. I guess you'll have more disease areas. But what we are also hearing from EU policymakers that we really need to also move the discussion to how we can address the preventable burden, and how we can, move from what we know already based on the cost to what we can do about this. So I was wondering if this falls in any way under the scope, whether you'll have some kind of a discussion part when you will be maybe sketching some directions, or what is your thinking here? And then I would have a brief second question.
Our thinking, it's currently very difficult to evaluate preventive measures based on economic data we have available. So what we have planned, I don't know if we can make it until November, but it's part of our project, is that together with Uwe Siebert, he is a modeling specialist from the University of Halle in Tyrol, we will evaluate for 4 disorders in a model how prevention changes the costs and the outcomes in this model. It's a model, but that's the best you can do if you don't have valid data. And I think we will be able to have a look in how much would it cost to do prevention, and what are the outcomes we can get with prevention. Nobody has done this at the moment. There are some studies who say we will save such and such amount of money, but these are just hypotheses. It's not based on data.
I'm extremely happy to hear that, because I feel this is really what we need as a field. And as you say, no one really did it. We don't have much data on prevention, although there was this disease control priorities publication by World Health Bank done 3 times. The last one in 2017 was including an extensive chapter on mental neurological substance use diseases, and was presenting a lot of effective interventions already that they calculated. Unfortunately, this was not then included in the latest publication of Lancet that looks at accelerating the adoption of SDGs, Sustainable Development Goal 3.4, to reduce the mortality from main NCDs, and we are not included in these big publications and discussions because we don't have enough data. So I think with data that you are now producing on also how we can prevent, this can help us. And my second very brief question is, after the first study, there was an effort to have country-specific papers looking at what would be national costs, which would then be very useful at the level of national advocacy. Do you think something similar could be done after the European data are put together?
What we have planned is we will publish, similar to the paper by Gustafsson and Oleson, both of them. We will publish a large paper on all countries and all diseases. Yes, but this will not be very detailed, for sure. We don't have 120 pages in a journal. So we will just have 15 or 20. But what we have planned is that we will, for every disease, And for in this special country, we will publish a short communication or a short paper. And Claudio Bassetti will ask the representative from each country to take over this part. Because, I mean, we are not able, I mean, we are a small group, we are not able to publish another 20 papers on this topic. And we thought that we ask the representatives, for example, from Romania, that they take over. We generate the data, how they need it for their publication, but they can publish then with first and last author, and we are in between, so that we get a huge dispersion of the data, especially for this country, because no politician from, let's say, Romania is interested in data from Germany, yes, and he will not read the entire paper for all diseases. But if he gets a paper in Romanian language, yes, from a Romanian physician or health economist, I think this will make much more impact than just a large paper.
Precisely. So thank you for these answers. I leave the podium extremely encouraged. Thank you.
Okay, thank you.
Please.
Thank you. I have to go.
No, come here.
Oh, thank you very much. Thank you very much, Professor. You have, during your presentation, I'm Romanian, first of all, and thank you very much. You are absolutely right in your statement regarding Romanian. Yeah, I absolutely agree with you that the politicians will be very reluctant to cooperate, and I know that from the practice. But my question, I have a short question for you. During your presentation, you mentioned your concern, you expressed your concern for the fact that you might not be able to include as many patients as you would like to in your study. My question is, have you thought of making use of telemedicine? Would that be feasible for your project? Thank you.
We have thought about telemedicine. The only problem is, even with that, we have to travel to the patients because it's not allowed, for example, in Germany. I don't know how it is in Switzerland. In Germany, it's not allowed to, you have to aufklären, you have to explain the study to the patients, yes, and then they have to decide, do I want to participate or not? And you can't do it with telemedicine, at least not at our university. So this is a problem because, I mean, most of the health economic studies, it's just questions the patient can answer by themselves. So what we, for example, did in Parkinson's disease, that it was an old study where we saw the patients in the clinics and then we gave them the economic questionnaire and they sent it back. We have to think about if this is feasible, but you need to have a good view on the clinical part. Because, I mean, there are a lot of health economic papers where the clinical part is really nonsense, yes? And so you need, or at least, I mean, I'm a neurologist, so for me it's important that we have a good characterization of the disease or the disorder, and we have a good characterization of the health economic part. And this is difficult with telemedicine.
So let me come back to you. I could ask you 1,000 questions, but allow me to ask you the last one. And this is done in general about health economics in sleep-wake, but in general in neurology, I would say. Do you expect any really exciting new developments in this field?
You mean in health economics or in neurological disorders?
Health economics in neurology, yeah.
I mean, the problem is what I mentioned already yesterday. In neuroscience or in brain disorders, we are still at the level of investigating the basics of neuronal glial function and of the brain. This is, for example, different in cardiology or in pulmonology. I mean, we are, I would assume, 60 or 70 years back to them. And they are not investigating, I mean, they aren't cardiologists who look for basic science. I don't want to diminish their impact, but it's not as much as we do now in neuroscience. So we are not yet at the point where we really put a large number of efforts and a large number of persons into health economic issues for neurological disorders. And you see this, for example, if you look at the publications you give in cost and heart diseases, for example, in cost and neurological disorders, you will find a huge difference. Yes? And so I think it will become more interesting. For example, if I look at my development, when I first talked about this, normally nobody was interested. Yes, if you look 10 or 15 years ago, it started slowly, and now more and more people are interested in this data, especially since this great paper from Gustafsson or the GBD data from Richard Dodel, which was published last year. I think people start, oh, this is an important point, and we have to look at that in more detail. But I think in the next 3, 4, 5 years, we will see much more papers and then a much better basis on which we can discuss health economic issues in the clinic, yes, for neurological disorders, or at a politician's level or a parliament level, and also on a scientific level.
And that's combined with the momentum that we have now that there's much more information on the burden in general of neurology. That should give us some hope for the future, I would say. Okay, thank you so much. I think we're well over time.
Thank you.
But this was a great discussion, and I'm looking forward to doing this again and further. Thank you so much. Thank you.